Okay, everyone, thanks again and welcome back from the break. So hopefully you had a chance to have a little coffee and some snacks and to view our posters, which will be up for the whole day. And so that's really exciting to see all the work already that we've done. So let me see. Okay. So we're going to really start by, really one of the things we really envision is the nurse-engineer approach. One of the powerful parts of it, we really envision it as real bidirectional, real-time collaboration to identify problems. And one of the things, I worked for 20 plus years in industry, and I got to work side by side with engineers and really got to experience firsthand the power of that collaboration, because nurses have a lot of operational level at the healthcare, of healthcare. Engineers are the most incredibly creative people I've ever known. So putting those two together and looking at the same problem or the same issue or the same thing you're trying to tackle from two different angles really does make 1 + 1 = 5. And so that's really what we want to do here at the center. And there's so many different things that we can work, the sky's the limit in terms of the different things that we can really improve on in healthcare, and so we got to get started right away. So the mission of our center is really to unleash the untapped potential of nurses and engineers working together as healthcare innovation leaders, and to foster the ability for rapid and effective application of both the nursing and engineering skill sets to identify issues and realize those solutions. And then to pioneer innovation through that intersection of those two skill sets. And to really play off each other and really try to understand and apply each other's expertise, because that's really how you make progress in these areas. Frank and I are the co-directors, so we're our team, just like we want everybody else that we're working with, or the folks at our center, to be teams as well. I'm a professor in the Elaine Marieb College of Nursing, and also a joint professor with the Institute for Applied Life Sciences here at Center, and it was actually the reason I came here to UMass, because I really wanted to be a part of a center that had a lot of interdisciplinary collaboration built right in, and the chance to be a joint faculty at the Institute for Applied Life Sciences. And any of you who haven't been able to see it, it's a beautiful 6-story building of state-of-the-art labs for anything you can possibly imagine. And so that's where our space is for the center. Right now we have some space in the open lab and then some other space for our students to work, and hopefully that will continue to grow. And I've focused my own research interests on medical product innovation in general, really to tackle with making sure that we have the front end user as a vital part of that product development process, and also a couple areas of technology which we'll talk about a little bit later.
And I'm Professor Frank Supp, the other co-director of our center, and very excited to be part of sort of creating the vision of the center and realizing it. And again, I'm the engineer side of this, as we sort of have the nurse engineer. And as an engineer, I like making things. That's kind of the classic. Most people get into engineering for that reason. And really my background is in sort of robotics and mechatronics, really bringing sort of this mechanical and electrical world together. And not just making things to make them, but then actually thinking about what are we going to do with these things, right? So it's really the design and control and how those interact with people, and how we design for people. So those include things like sort of prosthetics and exoskeletons, but also thinking about how we start to design robots, and how we also take that sort of robotic technology, right? Sort of the sensing, the action, and the thinking parts of those, and break those apart and use those for different aspects of sort of patient care in this sort of application. All right, so with the center itself, jumped ahead too much.
Oh gosh.
Oh, we got 2 controls.
Oh, you
I got this too.
Okay, never mind, I won't touch it. Sorry, say that. He's the technology person.
Yeah. As an engineer. All right, so as Karen mentioned, again, for those on campus know about this life science laboratory just up the hill, which hosts the Institute for Applied Life Sciences. And within that, up on the 6th floor, we have a small research space dedicated to what we're doing in the center. We also have some space on the 5th floor as well in the open lab space. But a big part of sort of nursing engineering innovation is actually getting into sort of the clinical space as well. So that's being able to leverage what is the simulation lab. So we have the nurses who are here, and if you haven't started your simulabs or will be starting those sort of in your sophomore, junior, senior years, essentially it's just this opportunity to go in there and basically train to be a nurse. But these simulation spaces are also great spaces just to do development. If you think about it from an engineering perspective, if you have a new product or you have a new idea, you're not going to take it straight to the hospital first. And having, and if you sort of have an engineering lab, which is benches and stuff, that's not necessarily, provides that environment, that's really going to help understand what are the missing elements, how is this really going to be utilized. So we have these simulation spaces that we hope to continue, not just use those for training of nurses, but actually being able to use that for really innovating new ideas in patient care. We also have similar sim labs down in Springfield through the UMass College of Nursing has a campus there where we run the accelerated nursing program and also a nice suite of facilities and simulation labs. And what's also down there too, if you think about home care, is there's also a an apartment. So if you think about home health care, aging in place, or persons with disabilities, right? So being able to actually start to think about how these spaces can also be used for new developments. And then also looking at kind of continued spaces that we want to develop, such as places like at the Mount Ida campus. All right, so again, that's kind of the physical aspect of the center. But a big aspect of what this center is all about is actually the people. It's the network. And here on campus are some of the faces that we're growing, which are really become the affiliated faculty here, representing both nursing and engineering, different disciplines, different focuses, but are coming together on to bring different ideas together about how to improve patient care for individuals. And for this, as part of the center, what we're doing is we're highlighting the opportunity to bring these nurse-engineer teams together. We already have 4 funded, basically, nurse-engineer faculty teams working on projects such as sensing, unobtrusive sensing for people in pain, doing that through vision. And these are people that may not be able to vocalize, right, or tell you what's going on. So people with dementia or Alzheimer's and those sorts of diseases, right? So being able to do these sort of observational studies of pain levels. Also, a big part of our center, and you'll be hearing more about this afternoon, is around smart IV pumps, and improving the safety and reliability of those. Also looking at, again, as you think about this network and you start to think about smart environments and data, the massive amounts of data, is how do we start to build an architecture to bring that data within the hospital, within the home, and within the patient, and bringing all those things together. And also just thinking about how do we do lifestyle modification and doing those in a culturally competent way, right? Everybody's gonna be a little bit different. Understanding somebody's background and who they are is gonna actually help you sort of be a big part of whether or not they're gonna be receptive to lifestyle modifications to improve their overall health outcomes. All right.
Okay. And one, obviously clinical partnerships are really, really important for us. So we can do a lot in the labs here, which is great. And one of the things we'll learn a little bit more about later is we do a lot of work with improving the safety and usability of IV smart pumps. What we do is we go do observations in actual clinical settings. We mock up what we see in the clinical setting, so everything's informed at the practice level. We do some tests in the lab, but then we still have to go back to the clinical settings eventually to see if what we found in the lab actually does go back and translate to clinical practice. So we're so fortunate to have collaborations with Bay State Health and Sedalia Vidal, which you'll see her. She'll be on our IV Smart Pump panel later this afternoon. Is a nurse scientist there, also a graduate of the Elaine Marieb College of Nursing PhD program. So we're going to be working together at Bay State to actually really do some deep dives into IV smart pump usability at the clinical practice level. We have a couple of grants to do that, so we'll talk about that later. This will help the hospitals with that'll be the 5th magnet, they're in the process of 5th magnet designation. So having nurse practice-based research is super important for that. And then also one of the things I really want to develop, and I've talked to Joanne Miller about, who you'll also hear from right after lunch. She's our keynote speaker. She's the Chief Nursing Officer at Bay State. We want to develop clinical innovation units, so units where the nurses are really excited to try new stuff, and that's really part of the job. Obviously with the transparency and all the patient safety protections that they need for trying new products. But for example, class 1 products, say a new dressing for a wound or something, or most of them, we can bring that right into the clinical setting. We don't need a lot of regulatory there's not a lot of regulatory hurdles for that as compared to more complex things. But either way, we want to build a couple of units where nurses just love doing this stuff. And so she's really into that. So that'll be really fun. And then what we learn there, we can bring back to the lab to test as well. We're also excited to have some collaboration with Cooley Dickinson, who's even closer to us. And so right now we already have a clinical match program, a workforce pipeline project, and we look forward to lots of opportunities for research and collaboration and really product development, innovation, practice innovation there as well. And the other thing I encourage all of you as nurses, if you're interested, we're building an active program, product usability testing here. So one of the things whenever you develop medical products, you have to sort of test it at various points along the way to make sure whatever you designed actually works in the way you intended. You sort of field test your own stuff hopefully before your final product release, which always hasn't been done, but it should be done because it's way better process. And so in order to do that, you actually bring clinical end users, so nurses in many cases, because we're the biggest profession, so we use more products and services than anybody, into a simulated clinical setting, and that's perfect here because we have sim labs. As Frank said, we have a nice sim lab in Springfield. We have one obviously right here on campus, and at some point we'll have one on the Miami campus as well. So you bring the product into the sim lab and you run it through the exact use models that you would use in the clinical setting, and you actually see how people use it. And that's how you can understand whether what you've tried to develop actually works. And if it works, great. And if it doesn't, you have to go back to the drawing board. So we need nurses, and we need our community nurses here. So for example, we've already done our first usability test on a product that was industry sponsored last week. And so we had a set of users. We had nursing students here, we had nursing faculty, and then we had practicing nurses from both acute care and long-term care. Because those are the end users of this, or the expected end users of the particular product. And they went through the exact use model, and we measured it, and the sponsor was able to observe. They're not allowed to participate, but it's really nice to have them there as first-hand observers so that they can see firsthand how well their products actually perform. So we need nurses to join our database. So in the back at our table, which is staffed by all of our summer intern students, so thank you very much, and say hi to them. They did a great job this summer. There's a QR code there both on a display as well as you can take a card. So if you'd like to join the database, we'll actually reach out to you and bring you in here. We'll either do our product usability testing, involves sometimes surveys and sometimes coming into the lab and actually running through scenarios. And it's all sponsored and you will be paid for your time. And so we want to build a big network of that. This is a picture of our folks. We were really busy all summer, probably busier than we had expected. So this was one of our summer meetings, and this is all the people that are involved, our graduate students, our undergraduate students. We have an MBA student in there. We have a couple doctoral students, and we'll talk a little bit more about each of them in detail later in the presentation. This is Janine Blake. Janine is just graduated with her PhD from the College of Nursing. She's a critical care nurse by background, and ended up focusing on improving the usability of IV smart pumps. But she actually took it to a whole new level, and she's looking at flow rate accuracy during actual clinical use. And so she has a whole independent program of research. Unfortunately, Janine couldn't be here today because she's due, what's the 13th, she's due in 4 days. She's not leaving her house. She's hoping the only place she's going is straight to the hospital because she's really pregnant. In fact, there's a side shot of her during the photo shoot, but I didn't put it in. And that was like 2 months ago. But I just wanted to point out, so she finished her PhD in nursing, and she's now gone on to started a postdoctoral fellowship with Dr. Juan Jimenez, who is here in the audience as well. He's a flow rate engineer, and this was the coolest thing about being at the IELTS. So Janine and I were talking about flow rate actually a couple of years ago, and I said, well, we understand the clinical implications, but we don't know a lot of the math, or we don't know a lot of the real principles between fluid flow dynamics. We need a fluid flow engineer. So I literally got on Google and typed like something along the lines of fluid flow engineer UMass, something like that. I got Juan. He's on the same floor as me at IELTS, only the other end of the building. So we reached out, and we've been working together ever since. So he's her mentor. So she's actually doing it in the College of Engineering, and we just found out about 2 or 3 weeks ago that her postdoc has been funded by the American Society of Engineering Education. So she's the first nurse to get that designation. So it's just a perfect intersection of nursing and engineering skill sets, so we're really excited. And then we also had, because we can't forget our business, in order to build products, it's great to have a cool product, but you have to have a value proposition. It has to be affordable. We have to be able to figure out a way to pay for it. And we had a couple people talking at the break about economics, and that's really important. So Nicole Anderson here is a critical care nurse. She works at UMass Memorial and also did her MBA program here. And we were fortunate enough to have her be our MBA intern for this whole last year. And she's just a dynamo. So she actually, she also had product development experience from her first year because it's a 2-year MBA program. So she actually knew how to make stuff, which was really cool. She's a critical care nurse. She knew a lot about social media, so she launched our whole social media. She worked a lot on the website because she knows a lot. I don't know how she learned all this stuff, but she knows a lot about a lot of things. Digital marketing. She did our first draft of our 5-year budget and our first draft of our 5-year business plan. And she also came up, one of the things we're working on is redesigning the bedpan. It's a really fun project, and it hasn't been redesigned in a really long time. So we collaboratively launched our project Gotta Go. And we've had 2 groups of engineers already working on it. And so we've come up with some really nifty ideas. And she just graduated in May and is now working as the Global Marketing Manager for Becton Dickinson in Urology, Critical Care, and Monitoring. And she was supposed to be here today, but of course they had a quick thing that they needed her for, so I don't think she's going to be able to come.
All right. And these are some of our current graduate students that we have. We have Hoon and Gina and Ellen. Hoon and Gina are both in engineering, mechanical engineering.
You should stand up. Have them stand up.
Oh, yeah.
They're all here.
I think they
stand
are.
up. Go ahead.
Yeah, there's Hoon and Gina. And Ellen was, here's Ellen up front. And they're working really at the intersection of sort of engineering and nursing. Hoon and Gina are really focused on the technical aspects of the robotic system. So if you haven't had a chance to see it yet, there's some posters, and the robot is here joining us. I'll talk a little bit about that in a couple more slides. Gina's also really interested in sort of the perception of robotic technology as well, too. So not just thinking about, as we think about the development and what's popular, and these robots sort of being on the cusp of society and maybe actually being able to help us in the real world, what is that pull? So not necessarily the push of sort of technology sort of into the healthcare business, but what's that sort of pull from the nursing side? How do we start to actually use these systems, understand what it is that they actually can do, how can they be best leveraged? So looking at the actual implications of it from the nursing inpatient perspectives. And Ellen is looking at flow management. She's been working with Karen for a number of years now, developing new systems, and she's also working as a critical care nurse as well, right? ER. So we're excited to have all 3 of them joining us and kind of building a baseline. We also have undergraduate students working as well, and these were undergraduate interns that worked with us over the summer. And we know we have 3 of them again in the back helping us out. We have Val and Joe and Braden are here, and also Jess and Anushre. So again, with 2 engineering students, BME, in electrical engineering, then 2 nursing students, and again at different levels too. From sort of sophomore to seniors in the program, so getting different perspectives from there. And also just thinking about the interdisciplinary collaboration that's needed. Again, it's the business side, but it's also Joe in communications as well, really helping us understand sort of how do we get this messaging out, how do we communicate, and developing all the work in order to really share the outcomes of our research. And then bringing in undergraduate students as well too, and one of the strong programs here, and this is actually a core within all the engineering, is the idea of sort of this senior capstone design project. And we have this across all the different departments of engineering, but really leveraging that with nursing. And a number of years ago, Cynthia Jocelyn, professor in nursing, Sundar Krishnamurti, and myself launched essentially a senior design focus, bringing in honors nursing students and senior capstone design students to work on basically assistive technology for older adults. And really sort of was one of the impetus for launching this center. And we've kept these sort of senior design project thrust going, bringing in nursing and engineering students together to work on things like the bedpan redesign for this coming semester, thinking about robot design for safe patient handling, and then also bringing them into the smart IV pump projects. We also have some history here, so this is some things that were done last year in our senior design projects. One was looking again at assistive technology for a younger
disabled child.
essentially a wheelchair that was going to essentially allow him to get from the floor to the seated position, right? That's very difficult, especially for a child who might want to be on the ground, but then getting them up and down, especially as they grow. The mother was unable to sort of, as kids get bigger, they all get heavier and heavier. So again, just giving him that sort of quality of life that he was looking for and helping out his caregivers. And then the Gotta Go project, again, this is something that's really sort of just fundamental. It's right, there's what is the basic design? What is it that's really wrong with the products that we are using today? And I think that's kind of how the project really started, usability studies, and then initial concepts, and then using sort of engineering technologies like 3D printing and sort of fast iterations to come up with some basic designs that they could actually complete last year, and then over the summer some more usability testings on essentially not a usable bedpan, but a usable bedpan that could actually be sort of functionally moving people. People could sit on it, move it, do the transfers, and actually start to get some feedback about how these can actually be improved. So it's really, really exciting work. And then also expanding this out is into coursework as well, too, right? So again, when we're going to train nurse engineers, it's not just giving them the research experience, but it's also within the classroom itself. Earlier this year, we released a paper on an Innovate program. It was a collaboration between Karen, myself, Sundar Krishnamurti, and Ellen. Really just sort of thinking about this concept of actually how do we get nurse engineers leaders, how do we get them innovating within the community, and really putting this structure together that really provides a template to actually start sort of a certificate program in undergraduate innovation for nursing engineering. Also, we've been in talks with other engineering departments. Is it possible to actually start a sort of dual degree program as a nurse engineer, and what that would look like? What would be complementary between the two programs, and how can we sort of feasibly get it done, meeting probably two of the most sort of demanding majors on campus in terms of the requirements and time that needs to go into them. But it's something I think we've already actually, I think Allison mentioned it before, we've already actually had nursing students actually reaching out to us about how it would be possible to start a dual degree. And then also just some coursework as well. We have 2 courses that we launched this semester. One is one of our freshman first year seminars being taught by one of our graduate fellows, Gina Georgia Dorelis, who's leading that, really focused on robotic technology in healthcare, and started sort of presenting that and what the options are, and starting to get students thinking about how to innovate in that space. And then also there's inclusive healthcare design in healthcare by Dr. Doug Eddy, who is works closely with Sundar Krishnamurti in the center. But really the idea in this class too is sort of how do we start to think about how do we get products out there, inclusive sort of design processes. And again, what's exciting about this class too is a 300 level class that's offered for both engineering and nursing students in the class.
Okay, and as I mentioned, we did do our first product usability, so we completed it last week. Thank you, Catherine Ellis, who I know is in the audience somewhere. She's from the UMass Innovation Institute, and really, so not only did we do a new test, but we came up with a new structure for a way to execute on this. We also had human subjects approval, which we will for all these, because when you bring in people from the outside, those are human subjects. And I have to say, our IRB here has been just so easy to work with, so I'm very appreciative of that. So
Institutional Review Board.
Yes, I'm sorry, Institutional Review Board, who says it's okay to do what you propose to do, because their whole purpose is human protections. And we actually, because we had, the product was, it's made for acute and long-term care, and it involves doing something to a patient to help them with their mouth care. So we actually had volunteer patients and volunteer nurse teams. And then we also had a really nice interdisciplinary research. We had as I mentioned, we had both our undergraduate and graduate students involved as research assistants and test administrators. But we also had nurses, faculty from the College of Nursing as subjects. We had plenty of nurses from the outside. And then we had a dentist, because dentists know more about oral care than any of us. And so he was actually the person that did some of the quantitative measures of how well this product worked. So it was really fun. And so those are just some pictures from the lab. And also one of those is one of the folks in the picture, and with at the top is one of my research partners that I've worked with for over 10 years, and she's a professor at California State. So it's really fun. So I think this is the first in, I think, many things that we'll be able to do with product usability. And the thing I really like about being able to do, I've done it as an industry person, but what's nice here is not only can we do the work, but we can involve students in it, so we can give them such a cool experience and some expertise that it would not otherwise have. And I think that's one of the real benefits of being able to do it at an academic center. Excuse me, in an academic institution. We'll talk a little bit more this afternoon about our IV Smart Pump initiative, but that's one of our two major initiatives. It's robotics and IV Smart Pumps, where we do the research. It's our program of research, and of course, we invite students to participate, as well as we also sponsor, as you've seen with the projects, things that are not our area of interest, that we just want to have. We want this to be a home to anybody who wants to innovate. But the goal, one of the things about IV Smart Pumps is they're probably the most ubiquitous piece of equipment in all of healthcare. We focus mostly in acute care, but IV pumps are used throughout, from in the home, ambulatory settings, in long-term care settings, and obviously in acute care as well. And they've pretty much functioned on really old linear peristaltic technology that has not been innovated in like 30 years. And so they might have worked 30 years ago, but they really don't meet the contemporary healthcare needs. And so that's really what we're focusing on. So we don't want to build a new pump. That I already figured out that that's not something we're going to be able to do. However, we can build evidence-based standards based on what we observe is missing from our clinical observation and our lab testing and back and forth. And so that's what we want to do. And we can also hope to generate some IP that maybe isn't a new pump, but can support the current use model and maybe sit on top of pumps. And that's actually the patent that we expect to file by the end of the year is in this space. The cool thing is we have lots of technical collaborators on this, so we have a lot of nurses working on it who obviously are the end users of the pump, and that's really important. Then we have Juan Jimenez, who's our very own UMass fluid flow dynamics engineer. But we also have Bob Butterfield and Tim Vanderveen, who worked for Becton Dickinson, which had been bought and sold probably 40 times, not quite, but probably 5 or 6 times during their tenure there. But they have issued or authored most of the patents on the pumps that are out there. So and they're both retired now and work with our center and serve as advisors. And in fact, we've co-authored papers together. They're just phenomenally generous with their sharing their expertise and helping guide our program of research from a technical standpoint. And then we also have Nat Sims. Nat Sims is actually the inventor of, for the nurses in the room, the drug library and the dose error reduction system. So it's this latest safety software that's on where you have to go in and pick the drug, and it sort of helps you calculate the dose. He invented that, and they first deployed it at at Mass General in 1996, I think, and it's become a standard. It's got over an 80% adoption rate in U.S. healthcare, acute care settings. And Nat has been and continues to be a really good collaborator for us as well. So we have reached out into our community to get the expertise we need to support our program. This is funny. So this is just some of the things that Janine has done in fluid flow rate accuracy. You'll see other pictures of our lab here, and I think there was one already. This was COVID lab. So COVID lab was in Janine's basement because we were all remote. So we literally bought all the pumps and her husband put up the shelf. We leveled it. We had Bob Butterfield, who helped us make sure that our testing was reasonable. And she did most of her initial all of her initial data collection in the year of 2021, mostly in her own basement. But since then, it's been moved to our own lab here. And so we really looked at what was happening. Anybody who looked at pictures on the news during COVID saw that we were moving pumps outside the rooms. And there's pluses to that because it helped with the PPE usage, certainly helped with the alarm management, just helped with working nursing workflow. People really didn't think through what that did to patient medication administration. None of it was good. I'm not saying that we shouldn't be doing it, but end users need to understand the trade-offs with that. So that's one really good one where we can take it to the lab, simulate that 30 feet of tubing, do our measurements, and figure out what happened. So we've looked at that. And we've looked at the clinically relevant setups, which is how the pumps are actually set up and where the bags are hanging, and again, measured the flow rate in our labs to see how that works. So we have a number of different things that we've observed in the clinical setting, mocked up in the lab, measured the impact, and all those publications are pretty much in process. And then, of course, we had some flow rate accuracy data collection that our students worked doggedly at this summer to collect tons and tons of data. And then we have a number of funded research projects that are active right now for 2022. So we have an SBIR, which is a Small Business Innovation Research Grant. Those grants, I really love those grants because they go directly to the small business, and then UMass is a subcontract. So we do a lot of the work with them. But so it's a really nice opportunity to collaborate with industry. So we have a grant that we're looking at developing a new, basically, device that goes on your lower legs to prevent DVTs while you're in the hospital. We just finished looking at that on sleep quality in our sleep lab here. We have our own fully functional, well-funded sleep lab in Isles. We just got a large grant a couple months ago from Delta Dental Foundation to study non-ventilator hospital-acquired pneumonia prevention by improved oral care in 2 hospitals in Chicago. We've actually already kicked that off with our initial meetings. Data collection is supposed to start November 1st. We have our own Shannon Roberts, who's been using eye tracking for years to study dashboards in cars and safety. And basically the user interface of the dashboard. Well, we can use her expertise to study the user interface of different medical devices, and we're going to apply it. She's actually in the College of Engineering, and she will be running our eye tracking study, which is totally cool. And she knows way more about eye trackers than we do, and she understands how to interpret the data and how to translate her knowledge from understanding the visual interaction with car dashboards to doing the exact same thing with user interfaces on smart pumps. And then we just got a nice grant to study some smart pump usage from the FDA as well. So we're going to be busy.
All right. So some of the other things that we're doing in lab is just thinking about this idea of sort of robotic technology in healthcare. And again, if you sort of have some examples here of what's out there, and if you do think about robotic technology in healthcare, usually what you might go to would be sort of robotic surgery, right? So you have a Da Vinci or something like that. And again, you sort of have this whole sort of class of robots that's very specific task focused. And the collaboration actually focuses a lot sort of on the doctor, right? The surgeon, engineer sort of collaboration. But you're starting to see the advent of these other systems enjoying these, what's being entering the hospital. A lot of those might have to do with supply chain, right? So if you think about sort of on-demand sort of ordering, moving objects, supplies around the hospital. And again, it kind of goes back to just basic nurse workflow, right? Of where the nurse is spending their time and how they want to spend their time. And again, I did actually spend a couple of years ago, I spent my sabbatical working with Honda R&D in Tokyo, developing basically different types of robots. And one of the operating principles that they did was, we want humans to be humans and we want robots to be robots, right? And also there's this idea of that you can use the robots to actually help people be better people. Right? So not trying to use people to be robots, not trying to use them to do things just because it's easier to tell somebody to do it rather than actually having something that may be automated and useful between them. But again, if you're going to start to look at these systems, what's important here is, there's the robotic framework, right? So you think about just how do you actually define these robots, how do you build them, how do you code them, how do you design them and make them do whatever it is that you want to do. But then also if you think about this sort of design thinking within healthcare, right? It's not just using the hardware aspect, which again, if you're going to design a robot, you might start and stop in this sort of domain, but actually thinking about how does this actually get utilized sort of in the hospital? How do we get in the home, in the clinic? And then actually prototype and test them in sort of the sim lab-based facilities that we've been discussing today. And then lastly, again, if you're going to put these together, then you sort of have this sort of building robotic technology with nurses, right? So what that means is not necessarily just getting, a traditional engineering process where I just go talk to a nurse and say, well, what is it that you want? Get the design specifications, and I'm going to go build it. But more of a collaborative, integrated process, right? Where you're actually not only just asking the nurses what they want, but actually bringing them into the design process. And again, not only that, but bringing the engineers into the nursing world as well, bringing them into the clinic, into the hospital, getting the firsthand experience so you can really start to understand what these robots and systems are going to need. So to do that, what we're thinking about is really trying to create sort of this sort of modular sort of robotic systems and that you can start to actually develop training programs for nurses and engineers to start to collaborate sort of this next generation of systems. So to do that, we really want to also have the ability to assess sort of the perception, and not only the perception of the nurses, but patient perception of such technology, what's going to be acceptable, not acceptable, and again, kind of the ethics and sort of compassion aspects as well too, sort of what are the tasks that robots should be done and what should they not do. Because it is this thing, thinking about what's in a hospital, it's not necessarily also being in a completely isolated, cold, sort of human devoid, sort of, a patient in your room and all you ever see is robots going in and out. But when is it that you want to actually sort of improve the overall care of a patient? So we want to sort of start to think about those things as well. And then the idea here is really just to develop these sort of prototype platforms, and that's what we have kind of over there in the corner you can see is essentially this is an off-the-shelf robot that we bought. And it's not an ideal robot for nurses and in the hospital, but it actually sort of fits the footprint. If you look at it, it's like, well, it's kind of like an IV pole, and we know IV poles more or less work to some degree. there's definitely room for improvement, but at least that footprint, right? So moving around, and again, using this as now as a test case, a usability study, what works, what's not working, because it's hard to think about things in the sort of theoretical sense, but now you can actually start to think about it in the practical sense and actually get things to work. So with that, we can look forward.
Okay, and so just a couple of more things. We want to just tell you a little bit about what we're thinking about doing next. So clearly, we want to continue to support our undergraduate internships, our postdoctoral fellow. We actually have a position posted right now for a postdoctoral fellow in human factors. We want to recruit new graduate fellows that are interested in really working on these types of things. We also have, we're just starting the search process for a new joint nursing engineering faculty, and we're co-directors or co-chairs of the search committee. And then we plan to offer some additional pilot grants probably later this fall. We also want to continue to disseminate what we're doing to bring more people into the fold. So we have active LinkedIn. We have a column actually called The Nurse Engineer in American Journal of Nursing. And so that doesn't go every month, but we give examples. We've published 2 and the third one's in the queue that really just give examples of nurse-engineer partnerships. And the AJN is a great way to disseminate because it's got a large audience. We have our center website should be launched very soon, and so that'll be a good place for you to go to get all this information. And then clearly we want to continue to publish and collaborate together at conferences. We're building operational excellence hopefully in our center too, so we're having some key hires. We want to continue to build our team of collaborators. We obviously want to engage our alumni, are super important. And then continue development. So again, I'll invite you, anyone who's interested in tell your friends to join our clinician database. These are just our current open positions. And with that, I think we're going to transition over to our actual nurse engineer team. So thank you very much. So you can go ahead and